am Dr. Lalit, Chairman Department of Ophthalmology, Amrit Hospital. Today I am going to give you a small brief about dry eye disease or dry eye syndrome. Dry eye is a very common disease in today's world. There are two reasons for that. One is we are using so much of gadgets, computers, laptops, tablets, phones to a great extent, and hence this causes a lot of evaporative dry eye. See, there is a coating of tears on our eye, as you can see here. This is our eye. It has to be coated by tears. Like we have saliva in our mouth to make sure that our mouth is wet always. Similarly, we have a small tear film which keeps the eye wet, moist, and it is also very essential for the clarity of our vision. But what happens is, if there is evaporation of these tears, this causes a lot of dryness, and the typical symptoms with the patient comes is irritation, grittiness, itching, dryness. These are the usual symptoms which the patient complains of when they come to our hospital. So we do an evaluation. We have a machine called the Sirius Pentacam, which also does a mammography tear film breakup time, which gives us an idea of how much of dryness is there inside the eye. So the tear film has three layers. The outermost layer is called the lipid layer, the middle layer is called the aqueous layer, and the innermost layer is called the mucin layer. If the lipid layer, the outermost layer, is not very healthy, because then it causes evaporative dry eye. And this outermost layer is secreted by a gland called the meibomian glands, which are available in our lids. So these glands secrete a little bit of oil or lipid which covers the other two layers of the tears, and hence prevents it from drying. Because if the lipid secretion is not good enough, or if it is very less, then the entire tear film becomes unstable, and this causes a lot of dryness inside the eye. Now this is where this particular machine, this is called the LipiFlow, and this is the latest in treatment of dry eye in today's world. So what it does is, it gives something called thermal pulse therapy to the meibomian glands and make sure that they functional well, and it causes the production of the oily or the lipid layer, which is the outermost layer of the tear film, and hence reduces the dry eye to a great extent. Now this treatment is usually done after the diagnosis of dry eye, and once the patient gets treated with this technology, usually the patient does not require drops, or maybe requires the drops to a very minimal extent, and this usually works for 1.5 to 2 years, and then the treatment has to be repeated after 2 years. The first line management of dry eye is usually tear substitutes. So basically tear substitutes are drops which substitute for the tears, and it is used inside the eye 3 to 4 times a day or as and when required. So my only suggestion or request to you people is, please avoid excess use of gadgets, because that causes a lot of dryness in the eye. Take a healthy diet which contains a lot of green leafy vegetables, fruits, papayas, carrots, and if you are a non-vegetarian, fish particularly is very helpful to reduce the dryness inside the eye. Have a healthy lifestyle, have a good sleep at least of 6 to 8 hours every day, and drink a lot of water, and do some regular exercises. All this will prevent a lot of dry eyes. Dry eye is also common due to old age, especially in postmenopausal women. So please take care of yourself. As I told you, take a healthy diet, do exercise, and consult your doctor. If you have any of these symptoms, please consult your doctor, because dry eye, if not treated on time, can cause blurring of vision and can cause a lot of corneal pathologies. So make sure that you get treated on time, get a proper treatment. Please follow up with your doctor and make sure you treat your dry eye well. Thank you.